I'm Eden. I'm 22 from Belfast, Northern Ireland. I'm currently in my first year studying through the Open University. So daily life for me can be and has been throughout my life tricky. I have severe food allergies to nuts and fish. And when I was first diagnosed with food allergies, it took quite a long time for me to get that diagnosis. I think it took maybe 3 years at that point. When I was also in school, it was hard navigating, missing quite a lot of chunks of school for different appointments. I think it definitely had a significant impact on my early education, especially in like primary school, but also in secondary school as well. I also experienced stigma, bullying, and issues with peers. One specific instance in primary school, the person brought in nuts and she's like one of my really good friends, and then she just stood beside me and ate the nuts deliberately and then went away to play with somebody else. So there was kind of that indirect thing, and then people just didn't understand why I didn't want to eat things, and I always like brought my own food and that kind of thing. But I was also really lucky in primary school to experience a lot of like positive things. So my mum is amazing, and she like bakes, and she used to like get me to bring in food for my friends, like baking and like other snacks and that kind of thing, and people used to eat it with me, and I just felt like a lot more included. Obviously, always trying a new food is always scary, even if it says that the allergens aren't in it. You never know. Cross-contamination exists, unfortunately. Social life is massive, and navigating new friendships and relationships, especially when you move through the different year groups and even moving into university as well. University brings its own challenges, like living on your own for the first time. There's just so much. And as an adult, whenever you're looking at jobs, navigating conversations around food and that, food is such a huge part of society and a huge part of culture, and especially here in Northern Ireland, like everything involves food in some capacity a lot of the time. So it can be quite overwhelming. The impact that having food allergies has had on my family has been a lot. Obviously, like appointments are always like during the day, that kind of thing, so my mum's had to take quite a lot of time off work over the years. It can be quite stressful navigating the healthcare system, and I think can be quite overwhelming at times. And I know now as an adult, I've found that as well. But I've also like developed a lot of new skills such as communication, being able to advocate for myself, and also be a lot more independent as well. I think there is definitely some differences in regions across the UK, but even just areas like in Northern Ireland, access to treatment, access to support, access to clinics is very patchy, and it's hard to have like there's no continuity. So I think that is definitely something that needs to be improved. I also think there needs to be more training in schools. I'm part of the Food Allergy Northern Ireland group, and that's something that we're really passionate about, is that education from early, and awareness and education and training for teachers, for support staff, and also for children and young people as well. I think just more of an awareness and understanding about the severity of food allergies and the impact that it has. I think there needs to be more social opportunities for young people with allergies. I think there also needs to, it's good to see like there's being research done, and trials and treatments for young people like under 18. But what about 18 to 25? I think we do feel left out, and a big adult allergy clinics can feel quite intimidating sometimes. I think there needs to also be more mental health support available for people with allergies, and also their families and carers, because it is such a big thing, and it impacts so many different aspects of your life, and people don't understand that.